Hi, good
Good afternoon,
afternoon.
everyone.
Yeah, so this afternoon, we're back. I'm Dr. Ivy Alvarez with Dr. Gil Shalsita. We are the veterinarians and founders of Animal Wellness Veterinary Hospital and clinics here in Cebu and Dumaguete. So this afternoon, we will be discussing about the secrets that your veterinarians want to tell you, but they can't when you're in the consult room. So, both of us are graduates of the University of the Philippines and has been in practice for more than 16 years. And we work with our associates in our practices so that everybody is in line. Okay, so Dr. Gils, are we ready to discuss?
I think we're ready to go.
Go ahead, Dr. Gils.
Uh, this is a cute Frenchie that we saw. So, secrets your veterinarian wish they could tell you. This is not going to be anything uh, too juicy, but there are some information that we definitely want you to know. So, number one is we have to go through a lifetime of learning.
Yes, so
When we begin as veterinarians, we have to do a lot of studying. Little did we know that even after graduating, we would have to do more studying. Well, don't you say, Dr. Ivy?
yeah, we need to read more books. We need to go to a lot of conferences, and even up to now, if there's no COVID, we still need to. We have a lineup of in and out of the country conferences. But since there's COVID, all of us are doing this education online, so it never stops. Just need to keep on continuing to learn so that we know what's the latest science for your pets, right, Dr. Gills?
Yes, there's so much to learn and so much new information that we need to be able to improve the way we treat our patients. No? We cannot stay stagnant and just stay with antibiotics that worked 20 years ago or medicines that worked 20 years ago. It defeats the purpose of medicine. There's so many new medicines, so many new techniques that we can use to further help our patients.
Yeah.
So these are a couple of photos of Dr. Ivy and I. This is with Dr. Alain Kahalen. She is a veterinary surgeon and she did a conference on orthopedics that both Dr. Ivy and I attended. And we also attended the Singapore Vet Show, wherein a lot of interesting innovations and new topics were brought up. Okay, we'll go to number two. So this one is something that we would like people to know because we always get a dog. My dog has this, and this via message, and what medicine. We get a lot of information from the animal itself, so we have to be able to see the animal. We have to be able to examine the animal. Uh, Most of the time, there are visual cues, audible cues, the way the dog is responding that we need to know in order to be able to diagnose exactly what is wrong with your pet. Not only, in addition to having the need to put the necessary lab tests, no? It
Oh,
makes a world of difference.
Dr. Gills, one thing about them or the pets being examined by us is that veterinarians are actually capable of understanding what we're seeing because our patients, they don't talk, they don't speak, but then when we do examine, when we do our thorough physical examination, and definitely with your help by telling us honestly what you have seen at home, what you have observed, and what you think is not normal helps us a lot in our treatment and in our diagnosis. So sometimes there are questions in our Facebook Messenger or in our phones asking us for the treatment for diarrhea or vomiting, or treatment for something that's really difficult for us to say na, okay, do this at home. But then if you do that, it might not be the problem. So it's always better, especially if it's an emergency. You know, when it's an emergency, when your dog suddenly collapses, that's you need to bring that to a veterinarian. And then we seeing them helps a lot in the treatment and the improvement of the disease.
A lot of times, also, we think it is not an emergency,
Mm.
but when you bring the dog or your pet to the vet, it turns out to be an emergency. Case in
Mhm.
point, the case we had yesterday, Dr. Ivina, the
Yeah.
puppy was brought in for vomiting, and it turned out that it had a very serious kidney problem, wherein we had to actually remove the kidney.
Yeah.
So simple things can be complicated, and complicated things can be an emergency.
Yes. So this is Dr. Lyra Lee. She's doing an examination in our Parkmount branch.
Each animal has different dosages for medicines. Not only wherein dogs, cats, birds, hamsters are need different dosage, they also cannot all get the same medicines. Uh, Cats cannot have paracetamol, so it's very difficult for us to recommend. Oh, my pet has a fever. What can we give? There is no um, human preparation that can be for dogs and cats.
Yeah.
That is without a guidance by a veterinarian.
Paracetamol, when given to dogs in a much higher dosage, not like the
Can
ones
also
that we take, can also kill them, can cause liver poisoning for the dogs. When we check our patient, we also check the weight. As you notice, when you bring your pet to the veterinarian, immediately we do check the weight. Why? Because after that, we compute each and every medication so that it's exact to the size of your pet, or it's exact to the condition of your pet. It doesn't mean that if you buy like last time I received some um, calls from clients, but it was understandable because the security during that time for COVID was really tight. So I would get a call. I would like to buy this medicine. It's for my cat. What is the dosage? So parang it's really difficult for me to say na, o sige, you give 1 ml, because it does not happen for pets. It might kill them, or it might be much less than what they need and it will not be useful. So it's always different. It's always right to have the perfect dosage for the medicine for your pets.
yes, and the weight is very important because certain medicines have to be given, like Dr. Ivy said, at an exact dosage. Other times, different breeds can have medicines that they cannot have. It's becoming less common, but it's something that your vet needs to know, and you should know as well. So it's not as simple as going to the pharmacy and buying medicine there. Okay. If you'd like to say hi on the chat, or
Dr. Gills would like to say
yes,
a shout out for Miss Alma Masiglat. She has
yes,
been our client for a long time and she's listening right now. Thank you.
yes, yes, we'd love to see Jiggy. Okay, number 4. We love what we do, but we also need time away.
Yes.
So your vet would give 110%, do everything he can to save the pet, or make sure your pet is safe as much as possible. But we do need vacations as well. We do need time away for our brain to relax and recharge.
And yes, veterinarians also sleep. So before the COVID started, we have our emergencies, no? But then, do you know that the veterinarian on emergency are actually working still in the morning because we do not have enough manpower to have the night and day shift. During this COVID, we stopped our emergencies just because we wanted everybody to be well rested so that the immune system is high. Another thing, pala, Dr. Gils, we would like to remind everybody that currently our house calls has been suspended for your safety and our safety, but hopefully the vaccines will be out so that everything will go to almost normal.
Yeah. So this is one of the secrets that we're not supposed to show. But we start off with a puppy, the same as you when you come in for your vaccines. We see them grow up, we see them get sick, and we see
We
them
see them age.
age, we see them pass away. And a lot of times this affects all the pets. We just need to keep our composure as much as possible when we explain things to you.
And sometimes you can see your vets crying with you because we cannot keep it anymore. No, it's also very painful for us. It's not because now we're treating them that it's okay for us to lose them. Totally opposite. Um, Not only the veterinarians are affected, but everyone in the practice, from the receptionist
Mhm.
all the way to the handlers, the nurses, because they have given everything just to help save that patient.
So especially newer veterinarians have a more difficult time with this, and they tend to cry along with the owners more often.
One thing about this, Dr. Gills, that I would like to um, at least for our clients to consider, it is very painful for us to lose our patient and at the same time getting blamed for the death because we don't like them dying. It's just that, again, we are just human being like you. We are not gods that can play with the lives of the patients that we treat. And science also has an extent to what it can do. So definitely, this is one of the most painful for me as a veterinarian, the losing of a patient. It's no joke, and every time that we treat our patient, we pray along with everybody else that this patient survives. Sometimes we would do surgeries that would last 4 to 6 hours just to save a life, and then after that surgery, if most of the time we're successful, but then the healing will depend on the patient, and then us getting blamed afterwards is really, really painful. Not only painful psychologically, but also physically, no? Because we don't want that to happen.
Yes, about the surgery, yeah, about the effect on everybody, you can feel the weight of losing a patient in the practice every time a patient passes.
I think, Dr. Gills, this is also one of the reasons why a lot of veterinarians is one of the top 10 that would commit suicide because of this, no? And this is what we would like to change.
We'd like for you to know that we are affected. So number six, we became veterinarians because we love animals. I can remember from being very young to having little chicks and hamsters and guinea pigs and absolutely loving animals and got really frustrated when they would get sick and pass away.
Dr. Giles, I have a question. How old were you when you decided to become a veterinarian?
I knew I wanted to get into animals. I, I would say about high school. How about you?
Oh, I really wanted to become a doctor ever since I was young. But then when I was in grade four, my dog got really sick with skin disease. And during that time, there was no treatment. And all I wanted to do was help my dog. So I wanted to be a veterinarian because during that time, being a veterinarian is not common. If you want to become a veterinarian, everybody will laugh because that's a career that does not have an opportunity. But luckily, I decided to go into vet school because it's my passion and I love animals to the point that it's easier for me to get along with my pets than with other people.
Very true.
And I,
So I think it's a commonality that we all have.
yes. So, but then what we don't like is that this is used against us. Just because we love animals, it doesn't mean that we will do, you know, the veterinary practice also needs a lot of expenses, and sometimes we can only do as much. It does not mean that we love animals, that we will make that animal suffer for a long time, even if we know that it's been suffering. Okay, so I think that's the only difference now and when I was dreaming of this job. So, oh, there's a question from Cherise. How? Okay, so can you expand more, Cherise, on the how? Okay. When we want to save some animals, please also be realistic. We can save more animals by helping more of them than just focusing on one that is already in bad shape and will, the first thing that we tell you as a doctor is that if this animal is in bad condition, we are very honest in telling you that. So there are some that you do everything. We do everything. But then sometimes if we have a lot of other pets that we want to save, in short, I want to save pets, then I think it's better for me to just make sure that the budget is enough for everybody, that I can share and help them all, than spend everything on one dog that we know that has a smaller chance of making it. That's my thought. How about you, Dr. Gills?
We understand why we want to save every animal. If we had a choice, we would. But if it comes between choosing saving 1,000 animals and saving one, I think most of us will say that we'd rather save the 1,000.
Yeah. Oh, this one. How much usually on tuition when taking the course? That depends on the school. During that time, we went to UT and our tuition every semester was 7,000 pesos max with a laboratory. But then right now, all the scholars that are being paid by our country are free. If you go to a private school, we don't exactly know how much it costs, so it depends. But then after vet school, all the conferences will depend on the body that held the conference. For the Philippines, it's around from 6,000 to 10,000. If you go out of the country, then the conference would be around 25 to 50,000, depending. Right, Dr. Gills?
Yes.
Yeah. So that's the question.
Okay. So this one is a topic that's near and dear to my heart, and I keep telling my clients that I have to recommend euthanasia that it's the absolute hardest thing for us to recommend and perform. But we have to keep that in mind. So not only when your pet recommends euthanasia, it's usually not what he wants to do. It's the last thing he wants. But sometimes it's the best thing to do. It is the last thing that was on our mind when we became veterinarians. It's the last thing that we wanted to do when we wake up in the morning. But it's something that uh, we have to do.
Yeah. So if we know that the pet's life is already, it's not going to be a good life. No, the quality of life will be gone. It means that they cannot poo, they can't pee, they can't do the normal things. Then I, I don't think it's fair for them. But you know what, Dr. Gills, it took me a long time before I did my first euthanasia because I really cannot do it because first my belief. I I'm not God. But then at the end, when you look at the dog and you know that it's really suffering or the cat is really suffering, one thing will come to mind, no? Am I willing to make this patient suffer longer and it's not functioning anymore? And the people, the family of that pet is also suffering along with it. It's really sometimes it becomes an advantage for pets that we have the option to euthanize them versus people suffering that we can't. But again, it will depend because there are also some owners that they don't like the pet anymore, and then they seek for this option, which we don't agree. So it will definitely depend on the case when we agree to do this or not. Right, Dr. Gills? Wow, this
Yes,
is really nice. Yeah.
yes. It
Um,
definitely is not any easier for the fur mom or the owner. Yes, we completely understand.
yeah.
It's not easy. It's not something that we wake up in the morning and want to discuss all the time. It's
Yeah.
just as difficult for the owner as the veterinarian.
The most exciting part for us is that in the morning we pray that we have patients and cases that we can actually help our pets with, not something that we cannot do anything anymore. Oh, Dr. Gills, can we have that again from Miss Elma? It's a really nice comment. No? The hardest part of being a firm mom is when you have to make the ultimate decision to put them to sleep. But then there are decisions that we need to make because it is better for our patient, not because of us. No, it's because of them.
Yeah, one of the things I tell my clients is, who are you making the decision for? Are you making the decision for yourself or for your pet? That's one thing you should ask yourself if ever you're in that situation. If ever you have to, if you're making a decision for yourself, then it might be that you're being selfish.
Um,
You have to think of the dog as well.
I have one story, Dr. Gills. I have this client, and her pet has it all. It cannot walk. It has cancers. It has everything, skin problem. But we discussed, and then we came to a conclusion that she does not want to put her pet to sleep because she can still see that at home the pet is acting normal. It can
Mm.
eat, though it can't pee on its own anymore, it can't poop on its own anymore. But then whenever she sees her owner, she's still very excited. So the owner does not have the heart to put this patient down. And definitely as a veterinarian, I support my client because she's doing her best to assist the dog, and the dog also is trying. Up to now, the dog was diagnosed. Was that last year, Dr. Gills, or more than a year? I think it was more than a
More
year
than a year.
ago. But then that pet has been on palliative care, and up to now it's still alive. And my client, though, she does not sleep technically because she just follows her pet everywhere to clean after her and make sure that she's comfortable. So that's really something. But then again, it depends on the owner and depending on the dog as well, or the cat. Yeah.
Yes. Those are our secrets. I'm sure there are many more that we'd like to add on later on at a later date, if ever we can make a second one. If everyone that's watching has like three secrets, um, I'm going to stop sharing so we don't end
Yeah.
on a euthanasia.
Yeah, it's
Um,
nicer to have a brighter topic than euthanasia, right, Dr. Gills?
yes. How about the Friday the 13th? What a day yesterday was.
Nobody expected that it's going to be
2020.
exciting. It
Yes,
is
quite
pretty much,
exciting.
yeah.
So we had three very difficult surgeries, very interesting surgeries yesterday. One is the puppy that had a kidney problem that was vomiting. The other was a puppy that did not develop his anus. And the third was a cat that was completely blocked and could not pee.
Yeah.
So Halloween came a little bit late for us.
But we're happy that it's not the 13th na story during surgery. Oh,
Yes.
very nice
But
question from Banana. Doc, lisod ba ang vet med? It depends. If you want to memorize all those parasites, the bacteria, the what else do we have? Parasites, bacteria, the Latin words of all the
medicines,
animals, the medicines. Yeah, it depends on what you like. Little did I know that it's going to be very difficult for me. And there's a lot of memorization which I don't like. And there's a lot of reading which I don't like as well. But then if it makes you better, then why not do it, right? So yes, but then we
if
encourage a lot of people to go into veterinary medicine now, especially that our country needs a lot of veterinarians.
it will only make it difficult if you're not enjoying yourself. If you're
Yes,
enjoying yourself, then you'll make a way through it, even if it is difficult.
yeah.
One of the biggest things that I keep telling the new graduates, the new vets that we encounter, is that whatever you had to learn in college, you will have to learn much more and know much more afterward.
And erase half of that to learn more, or more than half of that, and recall it every now and then, depending. And then, do you know that there are also some parasites that changes names every now and then? How difficult are they to remember? The like Dipetalonema. Now they are now Acanthocailonema. So, oh wow. Hi, Doc Elaine. Um, Alfie was very hard for me. He was darling at the hospital. See, so Alfie was one of our patients. Our client, she came from UK and then brought Alfie, and Alfie was such a sweetheart to everyone. And then suddenly Alfie got really sick, and the decision to put him to sleep during that time was between all the doctors that were looking after him and the owner, and it was very emotional for everybody because Alfie was the only one left, from the late husband of that owner. So it was everybody. So everybody was quite affected when we lost him. So thanks for that, Doc Elaine, and it was touching. So that's, yeah, the secrets. That's why, please don't get offended when we need to charge. Our priority is not only it's really not to make money out of our charging. It is also to update the equipments that we use to better the treatment that we can give to your pets. And also, not only that, we need to make sure that our hardware are updated, the software of our veterinarians are also updated, So we need to spend for a lot of continuing education every year for everybody. So that's where it is. Oh, hello, docs. Missing the OJT days we had in Animal Wellness Veterinary Hospital and clinics. Yes, we also take students from different schools for them to practice before they graduate. And yes, especially this year, we miss all the students because they cannot make it. We cannot travel. Nobody can move. So yes, Ajay, we also miss everybody.
Yes, we try to open up the minds of the students at an early age and have them realize what the potential of veterinary medicine can be.
Yes. So when we started the practice, actually when everything I know from before was that you just need to have one microscope and a stethoscope. That's what I'd see every time we bring our pet to our vet. And then it started to improve, and we saw some practices in Manila that they have so much more to offer, and so that's what we also wanted. And then we started seeing a lot of other practices out, out of the country, and they have so much more. So there's still so much more to improve, especially here in the Philippines.
Yes, we're much better than when we first started, where, like Dr. Ivy said, that it was a table, a chair, and a microscope, and maybe a ref. Most of the clinics and hospitals already have upgraded, thank God.
Yeah.
So here's another question. What are your advices, docs, for those persons who are planning to take vet med as a course?
That's a really nice question, Miss Banana. I hope you go into vet med. Okay, so vet school, you need to love how to read, to memorize, to enjoy, because definitely you'll be working with a lot of people who are more friendly to animals than to other people. But then it's worth it. It's difficult, but it's a nice profession. It's a very challenging course in college, and definitely if we compare ourselves to human practitioners, we might be leaning more towards the um, pediatricians because they cannot hear their patients talk. They cannot ask if they're in pain. They just need to know. Okay, so those are the challenges of being a veterinarian.
You also need a strong stomach
Yeah,
and a good back to work.
yeah, very strong stomach. Like yesterday, I smelled a lot of things that normal people cannot smell in their life. And then the back, yes, when you're doing a long scheduled surgery without sitting down and without eating, then yes, those two are very good suggestions, Dr. Gills. Lakas
Yes.
ng loob, lakas ng sikmura, at saka lakas ng likod. Oh, thank you so much, Doc Ivy and Doc Gales, for sharing this kind of topic from your former vet student intern. Thank you. Thank you for watching, Miko. So I think, yeah, Miko is now Dr. Miko and is also practicing. So this is it's actually quite interesting to read and listen to the questions and also these things, Dr. Gils, right?
Very interesting. It's a couple of things that we thought we'd share because in the heat of the moment and in all the calculating and thinking of what exactly is going on with the patient, sometimes we're not able to voice these things out. And we took the opportunity in order to bridge the gap or to try to so that we could explain a few things as to what exactly is going in the mind of your vet.
Yeah.
Each vet has his or her own method and way of talking to clients. And it's something that you develop. And like I like to talk to my clients, I like to talk to them by explaining what's going in my mind. Okay, I'm thinking it's this, or this. If it's not this, then we go back to this. Each one has or his or her different. I know Dr. Ivy does it a different way. She gets the complete life story of the owner first before.
He's just kidding. So that was a luxury of time that we used to have before. But now, again, we're still continuing our social distancing, especially now that there's a threat of lockdown again in Cebu City. Um, the only thing now is that we cannot really let our clients go inside the exam rooms and spend more time with them. So I hope you understand that.
Yes. Hello, Fiona and Mongo.
We love taking care of you, Fiona and Mongo. We love
I don't,
taking care of our patients. So
Fiona, I don't think minds too much. It's Mongo that doesn't like seeing me.
actually, Dr. Gills, we love seeing them, but they don't like seeing us.
True.
Not Fiona and Mongo, but a lot of our
A lot
patients.
of patience. Yes.
Some of our clients would even tell us, Doc, very smart kayo na kung iro because we are already in our way to Park Mall, and then they realize that that we made a detour, and their attitude changes. Murabag, they know where we are going, and they can smell, and then they're very happy. But when we go into the door, our dogs started to use their pads para murag na braking effect so that they won't go into the door. So
Yes. My favorite is there's this dog, a client and patient of mine that loves going in the car, and his tail is going 100 beats a minute until he gets to the parking of the Manila hospital, and then it just stays. He realizes it, and then it goes in between his legs. So these uh, patients of ours are um,
yeah,
very, very smart.
they know. I have one patient who we're checking for cardiac problem, and then well, for every patient that has a cardiac problem, you want to see how they're breathing, if it's normal or if they're panting. But then every time my patient goes to our practice, it's panting, and this dog has a special caretaker. Na, and so Yaya would always tell me that, Doc, he's very calm. He's not even panting until he starts going in the hospital, and he just cannot stop panting. So what happens then? I can't see anything. I can't listen to anything except for the. So that's when we need the help of the owners or the caretakers to give us the specifics, especially the assignments that we also ask you to do.
Yes. There's also the miracle of the clinic. So we have a lot of times where at home the dog is limping. It cries when it's being carried. It cannot walk. Then all of a sudden, when it gets to the clinic or hospital, it starts jumping around and walking normally, just to make sure that it doesn't stay.
Okay, so another one.
Miracle
I think,
crushes.
Dr. Gills, this might be a very heavy secret, no? Because the question is what makes it worth going to work every day? Parang hindi sulit. Actually, what prompts us to wake up in the morning, yung parang babangon ka pa ba? Babangon ka talaga because we don't know what we will encounter, how many lives we can save for that day. Well, we lose some, but we help a lot more. So that makes it worth going to work every day, and no money can pay that.
Making the difference in one pet's life, saving that one pet, is what's worth going to work every day.
Yeah. Okay.
Yeah, we're getting a lot of comments. We have to catch up.
Yeah, let's
So
make it faster, Dr. Gills. Just wondering on
yeah,
how the pandemic has affected the veterinary clinic industry in the country. What extra measures do all vet clinics do to keep everybody safe? Every clinic has a different measure to do to keep everyone safe. I'm not exactly sure what they do, But with us, we do the social distancing, we do the contact tracing. We actually have BPAs that when we notice that one is sick, what they do is they just check and they do contact tracing. Um, we also have the alcohols, the temperature check, and we make sure that at least now everybody's wearing face shield and masks properly inside the practice, and at the same time the social distancing is kept. So those are the things that
One
we
of
would,
the
yeah.
biggest changes, sorry, Doc. One of the
Yes,
biggest
excuse me.
changes is that our clients cannot enter the exam rooms as of now. As much as we would like for our clients to come in and we're able to explain, we have to take extra measures. That's one of them.
Yeah.
From peanut butter retrievers.
Butter is fine as long as the aircon is strong and given treats after injection. And this is also one of our problems now, that we need to make sure that the air conditioning is 26 degrees. And I really don't understand that. So with your mask, face shield, and the 26 degree, I don't blame others why they remove their shields and masks. So yeah,
But yes, treats are wonderful, and
we love treats after injections.
it's one of the best ways to distract, especially retrievers.
Yeah.
How do
Okay.
you handle dogs that are aggressive, like masuko sila if you touch or mo attempt to bite?
Yeah, this is with pets like this, we really need the help of clients, because if we cannot hold them, we cannot treat them.
You also have to remember that most dogs come to the hospital, they're not feeling well. So if you're not feeling well, you tend to be cranky as well. And if you wouldn't normally bite on a normal day, if your stomach is painful, you're going to bite somebody.
Yes, they can't punch anybody, so they will just try to bite. Na.
So the way we do it is number one, we have um, handlers as well as the doctors restrain the pet. There are different levels of restraint. As much as possible, we try to do as little restraint as possible. So we try to give treats like peanut butter retrievers, and we try to find the tickle spots. Dogs have 2 or 3 tickle spots depending. Sometimes under the neck, in between the shoulder blades. It depends on the dog. If we can get away with that, then most of the time we do that. Next would come the muzzles that we try to keep on as short a time as possible. And that's, yes, like Doc Ivy said, that the clients come in and are a big part of calming the pets down because it's something that they need to be familiar with.
Luckily, Dr. Gills, there are some aggressive dogs. I used to have a patient that he was extremely aggressive, to the point that even three handlers are holding him, he can still try to bite with the bosal on, or the muzzle. But then when he got 1 year old, he became a sweet boy. So those are the happy stories that we want. That they stop attempting to bite, because it's very painful when you get bitten, very painful. And then we cannot charge the client for the tetanus shots or the stitches or whatever that we need after.
I have a Great Dane patient that I've been handling him since he was little, and he would be aggressive to everybody else. And I literally can fit my entire hand down his mouth just to deworm him. And every time I deworm him like that, the clients that bring him in are like, huh? He's so good to you. Anybody else, he would have bitten the hand off. So it's an advantage that we start them off when they're this small as to when they're
So
giant dogs. um, so I think that's about it. Stay
Yeah, hi
safe.
Gilbert. Top Books is
Good.
one of the best source for veterinary books.
Yes. If there are no more questions, I think we have a couple of questions. No, Doc Ivy, would you like to start off?
Oh yeah. Again, for every discussion, we always prepare something for you. Like this time, this will be best for you. The pillar for your pet from Unleashed. Unleashed will be opening soon. This is right across Ayala Center, Cebu. It's in Solinea ground floor. And we will also have an alcohol that's easy for you to put in your pockets. So we have a question, but these things you can get from our Robinson's Galleria branch starting Monday. Okay. So my first question. Okay, number one. Um, ang difficult talk, girls. Parang walang facts pala. Can you ask na lang the first question?
Okay. Since you're going to be getting it from the Robinson's Galleria branch
In Cebu, please.
in
Robinson's
Cebu.
Galleria in Cebu.
Yes.
Yes.
Where exactly is our Robinson's Galleria branch located?
Yeah. So this is open for all those that do not work in our Robinson's Galleria branch. So if you can answer that, I have a clue. It's in the basement. So what basement are we located in Robinson's Galleria branch? So good thing about this one, Dr. Gills, is that we have an access to the parking. I hope Robinson's already opened their parking in our location. So it's easier for our clients to go in. But if not, you need to go to parking 1G and then just go down and yes, okay, banana. Oh, we cannot write it down, banana, because banana. I'll just give you kisses and Doc Elaine. Yes, hugs, virtual hugs. Okay, so that's the biggest clue. Parking one, and then you just go down. So we are located in basement. Okay. So, ay, sayang, walang nakasagot. We are located in basement 2 of Robinson's Galleria, Cebu. I hope you're ready to answer the second question because this one is a special pillar that you can use to give medicines to your pets without the hassle of putting your fingers inside.
The other advantage to Robinson's Galleria as well is the parking. There's a lot of parking. And when they open basement too, there'll be even more parking.
Okay. I know that the question number 2, Dr. Gills, this is our first Unleashed branch. Where are we located? So I just mentioned it earlier. We're right across Ayala Center. And what is that building? That building has all the condominium units across Ayala Center, Cebu.
C
Oh,
two.
oh, wow, sayang. Cash price na lang? Okay, do you have one last question, Dr. Gills? Oh, there will be an incoming sale for Robinson's Galleria Cebu, if I'm not mistaken. That will start on November 20. And we are included in the sale. Zip mouth na lang. Yes. Yes. Okay. So, Unleashed to be open in Solinea, Tower 2, ground floor. This is right across the entrance to the parking of Rustans. No? So, that's the one. That's Unleashed.
Yes.
Okay, Dr. Gills, do you have any more questions?
Yes, one last. We were listening to the medicines that cats cannot have. We mentioned one,
That is also very toxic to dogs.
if not given at the right dosage. What is that medicine?
Starts with letter P. Papa, papa, papa. Nako. It's quite obvious this time, Dr. Gills, they did not really listen.
I think they did. They were just affected by the secrets as well.
Yeah.
Another thing that makes going to work.
Wow,
There, we
Virgilio,
got it.
it's paracetamol. Congratulations. Paracetamol is very deadly to cats and it can also be deadly to dogs. So it depends on the dosage that they take. Right, Dr. May. Yeah.
There you
Kabalo
go.
ko, pwede lang ko magsaba. Okay, so Virgilio got that,
Disqualified.
and then you can get it. You can get this from Robinson's Galleria branch, Cebu. We are located in basement 2. Okay, so I think that's it for now, Dr. Gels. What do
That's
you think?
about it.
Yeah,
Yeah,
thank you
unless
so much
anybody
for
has any
listening.
other questions for us, thank you so much for listening.
Thank you.
Please join us. I think next week we'll have education.
Yeah, of pork malls. We will be sharing again next week. So, oh, 20th. That's the 21st, if I'm not mistaken. Yes. Okay. Thank you so much, and we hope to see you
Thank you so much.
soon. Yeah. Bye. Stay safe. Walang volume.